Hi everyone, I'm Susan Galinsky.
And I'm Denise Grace, and we're the founders of G Squared. For the best advice and information on how you can have a successful retirement, please subscribe to our YouTube channel and click on the notification bell so you'll be notified anytime we upload a new video. So, when should you start thinking about filing for Medicare? How do you apply for Medicare? And what about Medicare Basics A and B and the choices? So many choices. There's a myriad of them. How do you choose between an Advantage plan and a supplement plan? Prescription drug plans. And what about that dreaded donut hole? Well, by the end of this video, you should have a good understanding of how, when, and where to apply for Medicare and which of all of those choices is best suited for you. And don't forget, we're always available to help. Just click on that Calendly link below and schedule a brief chat with us.
Thanks, Denise. So when should you file for Medicare? Well, the magic age is 65. So 3 months before the month of your birthday and 3 months after, that's your window when you will apply for Medicare. Now, you're automatically enrolled in Part A. And it's B that you need to enroll in, and that's going to depend upon whether you are currently taking Social Security or not. But we'll get into a little bit about that later. So how do you enroll in Medicare? Well, there's a couple different ways. You can go to your local Social Security office. You can actually call. There is a toll-free number. Or you can go to the website and enroll right on the website. So let's talk a little bit about enrollment times. When are enrollment times? And for this, I'm going to show you this slide, which has the key points about when the enrollment times are. You'll notice that there's 4 unique times. The one that I just spoke about is the initial enrollment period, your 65th birthday. And you can enroll there 3 months before, 3 months after, or your birthday month. There's also 3 other ones that you're probably familiar with. The open enrollment, that's an annual election period. That is for changing, if you do not like the current Medigap or Advantage plan you're in, you can change October 15th through December 7th of every year. And I'm sure you've noticed the many commercials that happen on our TVs during that time too. There is a third, which is the general enrollment. And that happens January 1st through March 31st of every year. And that is enrolling if you did not enroll when you were first eligible. Okay? So you enroll in it. If you did not enroll when you were first eligible, a late enrollment fee may apply. But generally, too, a lot of people who may be working and still had their employer's medical coverage, this may be a time when they do it. And to that point, there is the last one, the special enrollment. Up to 8 months after employment coverage ends. You can enroll in Part A and B, then decide whether you want a Medigap or a Medicare Advantage. One point I want to make about this is they will ask for proof that you had qualified coverage to make sure that you don't get hit with that late enrollment fee. So as long as you provide them with evidence that you did have coverage up until that time, there are no late enrollment fees that will apply. So let's go forward here and let's talk about Medicare A and B and what they are.
Okay, so Medicare A is automatic. There is no cost. You qualify for it if you've had or your spouse has had a 10-year period of working and paying into the system. Think of A as admitted. It's going to cover your admission and your time spent in a hospital.
Right.
So A for admitting. Then we have Medicare Part B. Medicare Part B is something that you need to enroll in, but it is not free. There's a cost associated with that, and we'll go into that in a minute. Also keep in mind, there's a PDF attached to this video that you can download that's going to give you all of the details about the different parts and the things that we're going to be talking about going forward.
And you know what? That's a good point, Denise, because also the year that you turn 65, Medicare is going to send you a booklet. It's going to be about this thick. And it's going to have all that info in there too, but what we attempt to do is condense it down for you so it's not confusing.
Just give you what you need to know.
Yep.
So Part B, just think of B stands for basic. It's going to cover your doctor visits, which usually will have a small deductible, or if you're having outpatient care from a hospital.
Right.
So
outpatient.
Part B is, just think of it as basic. So let's just recap A and B. A is free if you or your spouse are 65, one of you, and has paid Medicare taxes throughout your work history for at least 10 years. Part B is not free. Keep that in mind. You pay for it monthly if you're collecting Social Security. They'll just take it out of your Social Security check. If you're not yet collecting Social Security, you'll be billed for it, and they typically bill quarterly and take it out of your checking account. So keep in mind, A is free, B, there's a cost associated. So what are those costs? Well, it's based on your income. So keep in mind, if you're married and you're both on Medicare, then these costs are per person for each of you. The basic cost is $164.90 per month, and it's based on your income, your gross income, and there's a sliding scale. So the more that you make as a single person or as a couple, those costs can go up. It can also affect your Part D coverage if you're taking Part D through a Medicare Advantage plan.
Right, and another important point there is that that premium can change on a yearly basis.
Does.
Yeah, but it can change too based on your income.
So what do Parts A and B cover? Well, Part A covers in-hospital care, like I mentioned. It doesn't typically cover you if you're traveling out of state, so that's an important consideration when choosing what type of plan you're going to pick.
Well, Part A will always cover you when you're out of state, but Advantage plans won't cover you when you're out of state.
I meant out of the country.
Oh, out of the country.
Out of the country,
okay.
Yeah.
All right.
So it doesn't cover those personal expenses while you're in the hospital, for the TV or the phone or those little perks that you might want to have. It doesn't cover in-home care or long-term care. That's a separate discussion that we may need to have. Yep. It also typically doesn't cover your hearing, your eyeglasses, or dental. Again, ancillary costs could cost you additional premiums.
Out of pocket.
Out of pocket premiums, or premiums.
Yes.
So it doesn't cover most prescription drugs. Again, that's a separate policy for a Part D or another type of prescription drug cost. And it doesn't cover those wellness benefits like gym memberships and things like that.
Right. So let's talk about then, what are the options besides Part A and B, which you already automatically have? Well, the government likes to make this confusing. So they call Advantage plans Part C. Okay, I don't understand why, but they do. And yet it's not part of Medicare. It's a separate policy that you have to cover what Medicare doesn't. So besides what Denise just talked about, a key point here is that Parts A and B only cover 80% of whatever your expenses are. So you're going to need either an Advantage plan or a Medigap, also known as a supplemental plan, to cover that other 20%. So let's talk about what that entails. So when you have Medicare Part A and B, you're going to make a decision. Do I want a Medigap supplemental plan, or do I want an Advantage plan, also known as Part C? And I'm sure you have all seen the commercials about how terrific Advantage plans are. And we kind of roll our eyes because the fine print below that you can't read because it flashes on the screen and then goes away in 2 seconds, that's the part that is most important. So let's talk a little bit about what a Medigap covers versus what does an Advantage plan cover. Okay? So what are the differences? Well, when we get into an Advantage plan, which is also known as Part C, as I mentioned, that covers the 20% that Medicare Part A and B don't. You will still most likely have deductibles, But the key thing that I want you to realize about an Advantage plan is that, one, you will be in an HMO or a PPO, so that means you'll have a primary doctor, and when you have needs that go beyond that primary doctor, that doctor needs to give you permission to go to a specialist. The other key thing about that is, obviously you can't go to any doctor you want, any hospital you want, anywhere you want. Again, if you travel out of state, you've just gone outside your area where you can get coverage, so you're going to pay out of pocket. Now, out of pocket, the important part about that is that each Advantage plan has a limit of what your out of pocket can be. So in this instance, it could be anywhere from $5,000-$6,000 all the way up to $8,000-$9,000 that you could incur every year for out of pocket costs, depending upon what you were hospitalized for or what you're going through on a medical basis. Okay, so let's compare that to a supplement or a Medigap. That plan allows you to go to any doctor, anywhere, anytime. In addition to that, it gives you a very liberal amount of days that you are allowed in the hospital. With the Advantage plan, you have 60 lifetime days. Once you've used up those 60 lifetime days, then it's all out of pocket. The Advantage plan has 365 days that they will cover you if you're in the hospital. Big difference, okay? So those are the key things that I want you to think about when you think about an Advantage plan, Part C, versus a Medigap supplemental plan. One more thing about that, and I just forgot what it is. One other thing I want you to think about is, with an Advantage plan, Part C, if you don't like the plan, you can only change once a year, which is during your special enrollment. Remember I talked about October 15th through December 7th? That's that special time. Advantage plans usually include D. Supplements, Medigaps don't. But you can change the plan in a supplement or a Medigap anytime you want. But here's the caveat. If you decide you do want to change after that initial time, remember I said no health questions? If you decide you want to change from a supplement plan N to a supplement plan G, you are going to have to health qualify again. And that's no problem if your health has remained stable and you're good. But if there's been a deterioration, you may not be approved to go to that new supplement plan because of the health issues. So just remember those key points. One more thing, Part D is usually covered separate, but I want you to realize that Part D is strictly voluntary. You do not have to have Part D. And again, that depends on your individual circumstances, because a lot of our clients, they are not on any medications, or they use a program like GoodRx or Single Care, whatever, to control their prescription costs. So those are just a few points. So let's look at the pros and cons then, just a quick recap here. With a supplement or Medigap, it is the richest in benefits compared to Advantage plan. You have guaranteed issue at age 65. Any doctor, anywhere. The cons, you could have premium increases, and the rates are set based upon the zip code that you live in. So if you live in a rural area which has very limited access to medical care, your rate could be higher than someone who lives in a big city and there's a lot of hospitals and medical centers around. Again, Part D is separate on a Medigap or supplement plan. Now, the other option is an Advantage plan. So what are the advantages of an Advantage plan? Well, it's usually cheaper. What's another advantage? You got Part D included, and it may include some extra benefits, and that's what they always talk about in the television commercials. You could, now notice they don't say you will, you could have extra benefits like dental, eye care, hearing, but again, it's in a network, so you're not going to be able to pick those doctors. You're going to have to go with the doctors in the network, and it is limited. So that's the pros. Now, the cons for the Advantage plan, as I spoke earlier, you could have some significant out-of-pocket costs. So to sum this up, I say that an Advantage plan is a great plan until you get really sick, and then it becomes a disadvantage plan. So obviously you can tell that Denise and I are more fans of the supplements or the Medigap plans just because the coverage is so overall compared to the Advantage.
It's about thinking long-term, your
Yes.
long-term needs rather than short-term.
Right.
So just a note here on the Part D, the prescription plans, I referenced a PDF that you could download earlier. That download also includes a lot more detail on Part D plans because there are tiers, there are a lot of complex details that you need to look at and take into consideration when deciding which type of Part D plan you're going to go for.
Right, and there's also something called the donut hole.
Right.
And a lot of people get confused by that. So that handout will kind of walk you through and tell you if you have any questions on that. Okay? We've gone through a lot today, and there's now questions that you need to ask yourself when you are shopping for and picking a Medicare plan. So to that point, let's talk about questions you should probably ask yourself.
Right. Again, it gets pretty complicated. So some of the questions to think about, to ask yourself: how often do you go to the doctor?
Right.
What are your health concerns? Do you have any serious illnesses that you're aware of that you're having treated right now? What is your family history regarding health? What kind of prescriptions do you take now?
Right.
What have your out-of-pocket costs been in the past? And what do you anticipate them to be going forward? Do you plan on traveling? Do you plan on traveling out of the country?
Right.
Do you plan on moving, having a second home,
Right.
or, downsizing? Because like Susan mentioned, where you live can affect how much your premiums are going to cost you if you have a supplement plan.
Yeah.
Some other things.
So, it goes to choices, right?
Mm-hmm.
Do you want the choices? Do you want the freedom? Or are you perfectly okay with being in a plan that has more restrictions, which is what the Advantage plans do, versus a Medigap supplement plan?
And keep in mind, everything has pros and cons.
Right.
It's like give and take.
Right.
And you have to, weigh out which suits you best.
Yep, absolutely. So keeping that in mind, we will close this session now by letting you know that as independent agents, we have access to all of the Medigap supplemental and Advantage plans that are out there. And we use special software that lets us pick the best one for you. We look at how is the carrier rated, how frequent are their rate increases, what else do we
Zip code, where do you live?
Yeah,
Right.
where you live. And we will find one that suits you best. So we are here as your advocates and also as your support system to get through this particular milestone as we become older and are eligible for Medicare. So to close this session, and the slide in front of you shows you just a sampling of the different companies that we work with.
So we hope you enjoyed this video, and please subscribe to our channel. Be sure and tell your friends and family about us, and hit that notification bell so you'll be notified anytime we upload a new video. And if there's a topic that you're interested in learning more about, you can just put that in the comment section and we'll take a look at that. Also, if you'd like to schedule a quick chat with us, just, maybe answer questions about Medicare or anything related to your retirement planning, just click that Calendly link below and schedule a brief chat with us. We'd love to talk to you. So,
in closing, we want you to know we appreciate you. And at G Squared, we believe that relationships are important, and G Squared is all about building relationships
beyond investing.